Hello, and welcome to the Oregon Housing Conference. I'm so glad you're joining us at this critical time for investment in our response to homelessness. I'm Jessica Vega Pederson, your Multnomah County Chair, and it's great to have this chance to welcome you virtually to this conference. And if you're zooming in from out of this region, welcome. I appreciate being able to take a moment to talk to you about our number one priority at Multnomah County, investing in a responsive and effective homelessness response system. We know the dual humanitarian crises of homelessness and addiction mean too many of our neighbors are living on the streets without shelter and the services needed to stabilize. No matter what a person's situation, focusing on getting that person housed and keeping them housed is our clearest pathway to supportive, long-term stability for the people we work with and serve. That's our priority at Multnomah County, and it's one we take very seriously, which is why right now we're partnering with jurisdictions and community-based organizations to increase our shelter flow-through and move more people living unsheltered directly into supportive housing. We know partnerships are key to our progress. When Oregon governments work together to share resources and ideas, we're better able to develop sustainable solutions that work. Our focus at Multnomah County has been doing just that, along with collecting regional data for a by name list that tracks those living on our streets so we can provide a pathway to housing that prevents people from moving from one location to another in an endless cycle. And we're working closely at the regional level to use supportive housing services investments to create a better, more coordinated continuum of care, one that includes outreach and shelter-based behavioral health services and an expansion of mental health and addiction recovery housing. We've already invested in recovery-oriented programs for people experiencing or at risk of chronic homelessness, especially those with serious and persistent mental illness or substance use disorder. Because of these investments, on any given day, we see more than 350 people with recovery-oriented services. And still, we know that's not enough, which is why Multnomah County will continue investing in improvements in the pathways from crisis to stability, through recovery-oriented stabilization, withdrawal management, sobering services, and recovery-oriented permanent supportive housing. We can't meet the needs of those living unsheltered without exceptional collaboration from partners like you, people working tirelessly to resource this crisis and to make an impact serving the most vulnerable in our community. For those of you in this audience with lived experience, I appreciate and value your commitment to serving our communities and giving back. Peer-based support is so critical to an individual's recovery journey, and I'm glad you're committed to being in this field and being a part of this work. Together, I know our commitments will impact many individuals and families, helping make it possible for them to turn a corner to wellness and stability. I hope you find opportunities for optimism and collaboration during your time together and in the ways you'll continue to support this work from here. Thank you for caring about people caught at the intersection of homelessness and addiction and walking alongside them towards a better tomorrow.